Support caregivers in healthcare roles and relationships. Why support matters. Caregivers play a role in the healthcare system, acting as a bridge between patients and medical professionals. Their responsibilities go beyond emotional support to include assisting with medication, coordination of care, and daily living activities. Understanding the roles and relationships of caregivers is essential for improving patient outcomes and overall care quality. Research has shown that caregiver involvement can influence both patient satisfaction and treatment adherence. However, caregivers often face emotional strain, role confusion, and lack of recognition within healthcare settings. Wolf and colleagues examined how family caregivers of older adults experience their interactions with healthcare workers. The study found that many caregivers are not regularly asked about their needs or understandings of care plans by clinicians. Those who are more actively engaged in communication with healthcare teams report better coordination, understanding, and patient adherence to treatment. Caregivers of individuals with dementia were found to experience more stressful interactions with healthcare workers because of the complexity of the care. The study emphasized inconsistent communication and empathy from clinicians' strength, caregivers' confidence, and reduced misunderstandings. Turner and Marino's findings relate to supporting caregivers in healthcare. Social support is a critical health resource. They found that individuals with stronger social support networks generally have better mental health outcomes. For caregivers in healthcare, this means emotional information and practical support from family, friends, and healthcare professionals can reduce caregiver stress and burnout. The social structure influences access to support. The study shows that the social support varies by class, age, gender, and marital status. This means caregivers from disadvantaged social positions, like being a single parent, may receive less support. In healthcare, knowing these disparities helps providers get resources and outreach to caregivers who are most at risk of isolation or overload. Gender differences matter. They found that most women report higher levels of social support, but also higher levels of psychological distress. This is especially relevant since most caregivers are women. It shows that even when women caregivers have strong networks, they still may face emotional strain, role overload, and social expectations that increase stress. Marital and relational ties strengthen resilience. The authors noted that married individuals typically experience higher support, which is linked to better mental health. For caregivers, this degrades the importance of maintaining strong personal relationships and the need for healthcare teams to take on supportive social environments. For structural inequality shapes caregivers' well-being, they concluded that social support alone does not fully explain differences in mental health. Structure factors like income, education, and access to resources also play major roles. For caregivers, this means that policies and interventions must go beyond emotional support to address societal issues such as financial strain, job flexibility, and access to care. Family caregiver perspective. Van Corvin and colleagues explained how family caregivers perceived their relationships with individuals living with dementia in nursing home settings. During in-depth interviews, the study revealed that caregivers want to maintain heartfelt emotional connections even as their roles shift from family members to advocates. Positive relationships were linked to open communication and inclusion by nursing home staff. However, caregivers who felt excluded from care decisions reported feeling of frustration and helplessness. The study highlights the importance of treating caregivers as equal partners in care rather than outsiders. Strengthening collaboration between families and staff fosters trust, emotional stability, and better outcomes for residents. In conclusion, for medical roles, Castledine calls for a balanced approach of the integration of medical roles within nursing. He believes that professions should embrace greater autonomy, when preserving its unique identity rooted in empathy and patient advocacy. Proper education and regulation will ensure that nurses perform medical duties effectively without compromising quality of care. Castleton has been thinking of a future where nurses' expanded scopes improve access, efficiency, and patient satisfaction in healthcare systems. Carlson and others investigated the roles of family caregivers involved in hospital at home programs for adults. The study found that caregivers assume new and demanding responsibilities, including medication administration and patient monitoring. When caregivers received good and annual training, clear instructions, and ongoing professional support, they felt more confident and competent. Many reported feeling unprepared for clinical tasks, which led to stress and uncertainty. Overall, providing education and structured support in at-home-based care can enhance safety, satisfaction, and the quality of care delivered at home. Community care. In this article, Doc Ray argues that while self-care is valuable, it is not enough for healing individuals and communities on its own. She points out that many people practice self-care in isolation, which can lead to feelings of loneliness and disconnection rather than lessening them. The article highlights how community care, mutual support, shared responsibility, and interdependence build stronger resilience and well-being. She provides examples of how community care can look in practice, sharing small favors, building networks, and leveraging digital spaces to maintain support. Ultimately, she calls for a shift that emphasizes me to we, which recognize that collective care is the key for thriving communities. Effectiveness of interventions. McGuyan and colleagues conducted a review that analyzed various programs, including educational sessions, counseling, and skill training. The results showed that multi-component interventions combining education, skill development, and psychosocial support were the most effective in reducing caregiver stress and improving well-being. However, the authors noted that many studies lacked standardized measures and long-term follow-ups. They concluded that the individualized and comprehensive caregiver programs are crucial for sustaining caregiver resilience. These are the statistics that I had found. According to the U.S. Census Bureau, about 41.8 million Americans provided unpaid care to an adult over the age of 50 in 2020. That was nearly 17% of the U.S. adult population. Among family care members of inpatients with neurocritical disease in China, about 34.7% reported mild burden, and about 27% moderate and 8.7% severe burden. Caregivers almost always spent more than 12 hours a day caring. Effective communication, mutual respect, and role clarity are essential to strengthening caregiver relationships within the healthcare environment. When caregivers feel valued and supported, patients benefit through improved continuity and quality of care. Healthcare professionals must work with caregivers into care planning and policy development. By fostering the partnership-based relationships, healthcare systems can improve both caregiver well-being and patient outcomes. Supporting caregivers ultimately supports the entire continuum of care. Thank you.